Welcome everyone to another wonderful episode here at Doctors of Podiatry. We're here in our office-based surgical suite. I think a lot of people will appreciate this video simply because as everyone knows, I don't really post a lot of the surgeries, but today we will be posting some surgery. We have a young gentleman that has, he just literally flew in from New York. We have a really nice, robust flying program. Patient just arrived. We're going to go ahead and I'll present the case, and in about 2 hours he should be back in the airport flying back to New York, right? So this patient has presented today with something that a lot of people battle, which is the notorious infamous mallet toe, the flexible mallet toe. So there's a big difference, and I'm going to try to kind of just hurry up in respect to the to the presentation and the history. So we have the hammer toe, right? The hammer toe, the classic, and then the mallet, which is only the tip, right? Mallet, hammer, and or both. So this patient has this really painful mallet toe, okay? And you guys can see it there, and that's exactly the money shot right there. The patient, this is something not aesthetic. This is something functional, which means that there is associated pain. Now, what we're going to go ahead and do is called a percutaneous flexor tenotomy. So we have two tendons, right? We have the flexor and we have the extensor. Okay. So it's very simple. This is kind of like it's a seesaw. Right? It's a seesaw. We have some, and we'll keep it very simple. We have the extensor tendons on the top, which extend, and then the flexors, which flex, okay? Now, a lot of people, and we've posted some of our YouTube videos, and a lot of people, there's a couple of videos that we've done this, that we've shown the world how we accomplish this. A lot of people, the number one question, Dr. Wagner, will the patient have, range of motion after? And again, that's a great question. It's a shame that you have to sometimes, sacrifice, so to speak, in this particular case, some of these, soft tissue structures, in this particular case, the tendon, to be able to do this, right? It's very simple. So if the toe, the mallet toe is like this, in order for us to take it from this, and I'm hyper exaggerating, to this, we have to sacrifice a tendon underneath. And that's a tendon that basically does this, right? There's a lot of, and this particular tendon helps, there's a lot of dexterity involved with that particular tendon, just like with our hands, right? Doing this. So it really depends on where you perform at what location. We're not going to get very involved in respect to surgery and anatomy, but the patient will have range of motion. He may not be able to, and it really depends on every patient, but the patient right now, let's just say, is able to do this, right? Really flex a toe. He may not be able to do that anymore. What he may be able to do is this. You see the difference? This, and then this, okay? And sometimes what happens is, the tendon really scars down, a little bit around, and he may actually regain that as well. Okay, it's kind of like a hit or miss, and I like to be very transparent with the world. When someone does ask me something like that, it's obviously we need to disclose that, because we don't want a phone call from someone saying, "Hey Wagner, I have a problem. I can't move my toe down. Is this normal?" Right? We don't do that. So it's very important that we disclose everything to the patient. Of course, the toe is going to be a tiny little bit longer, but I think I've spoken enough. I think we should put a pause to this, and let's get down to business here. Okay, stand by, everyone. Okay, everyone. So here we are. We set up the field, and we're ready just to perform the procedure. Again, it's kind of interesting. We're looking at the foot here from the bottom, and you can actually see that the toe is, this gentleman has been walking on the tip of the toe. That's gotta hurt. So without further ado, again, we've numbed the toe. Nada más relájate ahí un poquitito, okay? And then what we're gonna go ahead and do is we're gonna release that, and if we're quiet enough, You guys may hear a little snap. We'll see if we can accomplish that. People really like to see that. So again, here we go. I just want to make sure the whole world can see, because okay, so here we go. No one will say anything. Ladies and gentlemen, we have finished the procedure, okay? And that was it, okay? So now, as everyone can see, the toe, the tip of the toe is floppy, so to speak, right? Now, let's bring it down, patient, the foot. And it's, see, there's no resistance. So now what we do, okay, is we're gonna splint the toe like that for a period of about 3 weeks. Okay, a little steri strip, boing, and that's it. The patient will no longer have to walk like this. This is what it was, originally. But there was so much tension that I'm sure you guys will probably hear like a little snap, crackle, pop, like a little celery-like. And again, sometimes you don't even have to put a little stitch. Some people, depends on the surgeon. Some people do this percutaneously, even with a little, 18 gauge needle. I like to kind of, everyone's got their own little, technique shtick, and I like to use this little blade just because, as you guys can see, it was very, very quick, and I know with certainty, right, that we're gonna transect. And just in case, okay, just in case, what I'll do again, so everyone can see that's the blade. We'll kind of go again, and just to make sure that we have, that there's, that all the little strands of the tendon have been transected. Even if there's a tiny little strand holding on, believe it or not, okay, believe it or not, that will actually hold that tip of the toe down, okay? So now what we're gonna go ahead and do is we'll put a little suture, okay? Sorry about that, this bed, okay? A little suture like this, okay? It's a really, really great okay, and just like that, okay, just gonna go like that, and we're all set, and just like that, okay, grab both ends like this, snip. And ladies and gentlemen, we have accomplished what we call a percutaneous flexor tenotomy. This way a second. That's it. It's such a wonderful procedure. Patient, how are you?
Great.
Local anesthesia. Patient's awake. We, out of common courtesy, we put a little something so he doesn't, so he doesn't look at the field. Sometimes, and I know my mask is falling, I apologize. But we want to make sure he doesn't pass out. You feel good?
Oh, I feel great.
Me too.
Are you done?
Hey, yeah, I know, right? You're like, I came all the way from New York and now, oh God. Yes, people, something that we have noticed is that people, and we talk about this all the time, people will make the investment, such as this gentleman, to jump on a flight, come here to Miami, have the procedure, and literally we were able to coordinate everything and orchestrate everything in such a way that he's, in and out in literally, how long have you been here?
Half hour, an hour, an hour.
Say tops an hour. He's gonna go back to Fort Lauderdale Airport, and that's it. It's a phenomenal, phenomenal procedure, as everyone, just witnessed. Flexible mallet toe deformity. Hammer toe, mallet toe. Patient, I'm gonna give you the floor. I'll give you 30 seconds if you wanna say anything, whatever you wanna say. And if you don't wanna say anything, that is okay as well.
Thank you, Dr. Wagner. I appreciate your expertise and thank you for changing my life. I've been dealing with this issue for several years, and I'm glad that I found you through YouTube, and I made the decision to come here. And I appreciate you very much. Thanks again.
We genuinely also appreciate you choosing us to help you with the clinical presentation, providing these long-term solutions, which is, people make, for everyone out there that is not familiar with the mallet toe is an extremely painful, it's a very painful condition. He's been walking on the tip of the toe for I don't know how many years. So it gets to a point, not only that, he's active. So, he works out, he runs. I mean, can you imagine running on the tip of that toe? And, we do this procedure a lot for also diabetic patients or, preventative. We were just talking about the left foot, the left second toe is on its way. So we focus our efforts on prevention, not only for young individuals such as himself, but also for diabetic patients at risk that may develop an ulceration and so on and so forth. I can continue to talk, but I think I'm gonna call it quits right now. I'd like to take this opportunity to thank the patient for allowing us to do this little video. I think it's gonna, help a lot, with respect to education and to the entire world. This is, again, I don't really post a lot of these surgeries, but I think it's gonna be a little gift, a little token from all of us to all of you. As always, we will continue to do what we do. In this particular case, we will continue to change the world we'll just say 1 foot and 1 mallet toe at a time. Have a wonderful day, everyone.